Good morning. Today we're going to celebrate with our men the International Men's Day, which took place last week. And with me today we have two doctors, both men, one from Nigeria, one from the UK, celebrating with us today the International Men's Day. Thank you, Dr. Leye and Dr. Wasiu, for coming on the program. It's a pleasure to have both of you with us today.
Thank you for having us on the program.
Thank you. It's my pleasure.
So, Dr. Wasiu, if I can just kick off with you. You're a general physician and you are also a man. So can you tell us, from your perspective, both as a doctor and also as a man who is also getting on and anticipating, some years into the future, what are the common things that really affect men in Nigeria today as they age? And what are the kinds of things that you wish people would do to help themselves age better?
Thank you, presenter. So I'm so delighted to be here. So part of the health challenges facing men today, especially in Nigeria, we have many of those health issues which usually faces men. And the commonest of all is the cardiovascular disease affecting the heart, whereby some of them come down with hypertension, stroke, or heart attack. And most of the time, it's usually due to an unhealthy behavior, such as smoking, alcohol intake, stress, and inactivity has been implicated in the causes of some of these cardiovascular disease condition. Another important health issue usually facing men, especially in this country, is that of type 2 diabetes mellitus, probably due to any family history or due to a sedentary lifestyle, inactivity, and also increase in sugary drinks or food has been implicated in causing health issues among men. Another one is the cancer affecting men, especially the prostate cancer, which the other speakers will talk details on that, the prostate cancer and colorectal cancer and lung cancer. These are the three commonest cancer affecting men. So the prostate, the colorectal cancer, and the lung cancer. And also we have the liver disease. That is what we call alcoholic liver disease, usually affect men, especially when they consume a large quantity of alcohol intake. And also we also have what is called an obesity or metabolic syndrome. So obesity usually due to either lifestyle, low physical activity, sedentary lifestyle. They eat more. Most of these men, while at work, they eat more of fast food, they take a lot of sugary substances, and there is no portion control. So they also came down with some of this condition. Another important one, which is very common among men, is the sexual health problems, which some of them might present with erectile dysfunction, reduced libido, and these are usually associated with either in having uncontrolled blood pressure, we have hypertension, or smoking, or stress, which could also affect erectile function. So these are some of those health issues that are usually common among men. But lifestyle, some of the lifestyle changes that should help in management of some of these health disease is that, one, they should take more of fruits and vegetables. High fiber diet has been noticed to increase the well-being of some of these disease conditions, and also physical activities, exercise, because most men around this age engage themselves in stressful activities, overwork. They don't have time to engage in activities, physical activities. So part of those things that will also help to in managing this patient is they should involve in physical activities regularly. And also is that for some of them who smokes, it's also better for them to stop smoking, and also for alcohol intake to reduce it, because increase in alcohol intake, especially for those who consume large quantity, that has been noticed to increase some of these health issues among men, especially the liver disease. And also stress management too is very important in these men. So there is time to take a rest, time to sleep, adequate sleep, and also healthy diet generally should
Thank you.
help management of these
Thank you.
patients.
I mean, you've talked about men, but you've talked about them in the abstract. You've not talked about men as in you are a man. So can you share with us, from your own personal perspective, some of the things that you do, or maybe things that you wish you were doing, or maybe things that you intend to do better to encourage other men who are listening from your own personal perspective?
So part of an important thing which will assist as a man is that how do you cope with stress or work pressure at work? Because chronic stress has been noticed to increase in blood pressure. So as a man, part of those things is for us to have an adequate sleep. An adequate sleep this time around, we're talking about 7 to 8 hours every day. So no matter the conditions, no matter the stressful activities at work, you must ensure that you observe the 7 to 8 hours adequate sleep every day, irrespective of the challenges at work. Another important thing is the sedentary lifestyle. This lifestyle that some workers at work, they will sit on the table, consulting table, or probably at office table, they will be there throughout the day, except probably they want to urinate, or they want to defecate, or they want to eat. This is the sedentary lifestyle. Inactivity has also been noticed to have worsened some of this erectile dysfunction in men, and also increases obesity, and also worsen hypertension. So part of those things that I want to encourage men is that physical activities should be part of our routine activities daily. Exercise at least 3 to 5 times in a week, every week. Either walking, jogging, swimming, you should engage in some of this exercise at least 3 to 4 times in a week. So okay, by doing so, it will help to improve.
Do you do so? Do you do that exercise 3 to 5 times a week?
Yes, at times I do that. Initially, I've not been doing that, but at least in the recent time, but by the time one is getting to 40 years and above, these are some of those things that we expect individuals to start doing, even if they've not been doing that before, because it's going to improve their mental health, it's going to improve their cardiovascular health, and also improve their mental health too. These are some of those things that we can also do. And also healthy diet too is very important. Fruits, vegetables, high fiber diet, beans, and some of those diets are very important in order to achieve a better healthy outcome among men and also in the aging population.
Do you do screening? How often do you do your own screening, and how often do you recommend that others do their own?
So generally for screening in men, we start doing screening even as early as young adults, talking about 20s, and by the time you are getting close to 40 years, it is very important for you to start doing screening. So maybe I got to that age, even as at 35, I start doing some general screening because, for instance, my dad is hypertensive, my mom is hypertensive. I have a risk factor to develop hypertension. So I start checking my BP regularly on a daily basis, and also try to reduce stress, because of stress has been noticed to increase hypertension among youth in the recent time. So I do that on a regular basis. I check my blood sugar on a regular basis, and also part of those tests that we also do is to check for eye test, because as early as 35, 40 years, you go to the ophthalmologist to check for visual acuity, to check if there's any issue with your eyes, and also for dental too. So these are some of those things that you can also do. The dental, you check for your kidney function by doing the electrolyte and creatinine. If there's any risk factor, we want you to be doing those things on a regular basis, yearly. Check for your cholesterol level yearly. Check for your liver function test. Check for your heart by checking for your the blood pressure. Check for your sugar. Either you do the fasting blood sugar, or that's what we call HbA1c. We also do that. And also part of the screening, especially when you are getting above 40, is the prostate specific antigen, which you also do, and also ECG, electrocardiogram, to check the state of your heart. These are some of the tests that you do. And most of the time, when there is risk factor or positive family history, you should do those tests yearly. It's very important so that you can detect some of these things early enough and appropriate management can be instituted.
Fantastic. Thank you so much, Dr. Wasiu. We really appreciate that. Thank you, Dr. Leye, for coming on the program with us. This is a very important program. We are using this program to celebrate men and to celebrate the International Men's Day, which took place last week. And so, you know, we had spoken earlier to Dr. Wasiu, and he pointed out a number of issues. And you are a urologist, and not just a normal urologist. You also handle particular areas, because urologists handle special areas for men. From
Indeed.
Your personal perspective now, can you tell us, because what we want our men to be healthy, we want our men to grow old and to grow old well. But, you know, in Nigeria, men have a terrible, very low life expectancy, and also the quality of life ends up not being good at all. So from your perspective as a urologist, and also your perspective as a man, what are the kinds of things that you want our men to do and to ensure they live a better, healthier life?
Firstly, thank you, Dr. Ajayi, for having me on the program. It's a real pleasure and honor to join you on this call today. This is a very important area of conversation today, and I'm very pleased that you're focusing on this on Doctors on Air, so thank you for this. I mean, men's health is a real issue. When you look at life expectancy, women live longer than men. Okay, if you look at WHO statistics, women live longer than men. And if you look at the Western world, all the screening tools that are out there are focused on women. Smear tests, pap smear tests, mammograms. There's absolutely nothing on men. And I'm so pleased that you're focusing effort and energy on this sort of topic and shining a light on men's health. The whole issue of prostate disease, in particular prostate cancer, is very common, especially in the African American men, in black men, and in particular in our Nigerian population. I, as a urologist, look after a lot of men, and I see and I'm diagnosed prostate cancer in very young men. Some of it, we're not really sure what the causative effect is, whether it's environmental, whether it's genetic, or what exactly the causative effect. But we do know that black men get prostate cancer earlier than their Caucasian counterpart. We also know that when they get prostate cancer, it's often aggressive disease. So it's really important to talk about this topic. Now, another area to have a conversation is really how do you reduce your risk of prostate disease? Okay? As Dr. Wasiu had said earlier, and it looked through, it mentioned a number of salient points. Again, you know, we probably maintain our cars better than we maintain our bodies in Nigeria. And if I can encourage a lot of our men audience is really to be introspective and to look after themselves better than they are. And I must say, over the last decade, I think due to social media influence, a lot of men are looking after themselves better. You often see people running, going for jogs, going for run, going for long walks, and this is only a positive thing. Obviously, having the geographical location to do these exercises is also a challenge. Joining clubs to exercise, be it cycling club, running clubs, etc., all very helpful. What can men do themselves? It's very simple. As Dr. Wasiu said, I think you have to prioritize certain things. Making sure you have adequate rest is critical. Sleep, you can't underestimate the wellness, the importance of sleep. If you smoke, reducing smoking is critical to one's ability to reduce carcinogens, which reduce the risk of prostate cancer. There are various dietary things that we know can cause prostate disease or reduce your risk of prostate disease. A lot of the research has been done in the Western world diet, so not necessarily in Nigeria. So having tomatoes, the little cherry tomatoes, they call them pomodorinos, which is seen in the Mediterranean countries, are full of lycopenes, phytoestrogen, antioxidants. So this is thought to really help to prevent prostate cancer. I'm not sure what the equivalent is in Nigeria. Eating animal fat, we know increases your risk of carcinogens. So if you enjoy your suya, I'll probably encourage them to reduce the amount. I'm not saying don't eat it because it's delicious, and I don't want to deprive anybody, but I think in moderation. Okay, animal fats I thought to be not necessarily good. So having fish high in omega-3, very helpful. Having various, salads, even egusi and foriro, all these stuff are healthy, not frying them too much. So that's quite interesting. Now, from a urological perspective, the key thing for me as a urologist is really for men to listen to their body. Okay?
Yeah.
When the man's bladder and prostate, there's a synergy in the way it works. So the function of the bladder is really for one to store urine and for you to pass urine when it's socially acceptable. Now, I mentioned what's socially acceptable because if you look at the two extremes in life, babies and the elderly, they often pee when it's socially unacceptable, incontinence of urine. Okay? So
Yes.
babies can control themselves, elderly population have incontinence of urine, be it stress incontinence or overactive bladder. So that relationship is important. So men should listen to themselves. If they find they're going to the toilet more frequently or getting up several times at night, there could be many reasons why, and it's not necessarily always due to prostate or prostate cancer. If they're diabetic, for example, that has an impact on the bladder. If they consume large volumes of alcohol or coffee, these are diuretics that make you pee a lot. So it's important they're aware of that. Reducing that intake of alcohol or caffeine will obviously get them a better night's sleep. A lot of patients are hypertensives. They're on diuretics, which make them pee a lot. So that doesn't necessarily mean they've got prostate disease. It just means that if their diabetic control could be improved, or their blood pressure control could be improved, or using different types of blood pressure medication, which doesn't cause diuresis, that also might be helpful. Okay, so those are some of the common themes that we talk to our patients to try and improve their lifetime. A lot of men can also have voiding symptoms, so difficulty urinating. This could be due to many things. It could be due to a prostate. Again, increasingly we're seeing patients develop urethral strictures due to sexually transmitted diseases.
In the past?
Gonorrhea,
Yeah.
chlamydia can cause urethral, particularly gonorrhea can cause urethral stricture. So being aware of that your pain or your flow is slow or you're going very frequently to urinate is something to be aware of. Now, when you see a urologist, when you have symptoms, you see your doctor, there's a blood test we ask our colleagues in primary care to do. It's called a PSA. PSA stands for prostate specific antigen. It's a blood test that tells us the risk of prostate disease, in particular prostate cancer. You can have a raised PSA because you have a large prostate gland. You can have a raised PSA if you have prostate cancer or an infection or inflammation. So there are many factors that can cause a PSA. If you have PSA after sexual intercourse, if you have blood tests immediately after sexual activity, that can affect the PSA. The normal factor of PSA is under 4. If it's over 4, it is common for patients to be investigated. And we investigate our patients, one, to exclude infection, two, to do an MRI, a scan called an MRI, to look at the detail of the prostate, the size of the prostate, whether there's any suspicious lesion within the prostate that one needs to focus on. And if there is a suspicious lesion, I always use the analogy, imagine an orange. The seed of the orange is the cancer or the suspicious area. To diagnose that, you need to be able to biopsy that particular seed and that particular seed alone, not just the surrounding tissue. So what we offer patients is a particular specific type of stereotactical prostate biopsy called an MRI ultrasound fusion transperineal prostate biopsy. That's a mouthful, isn't it? It's quite a
Yes.
mouthful. But that is state of the art way that we biopsy our men. So we're not just sticking needles into the prostate and causing inflammation and causing a risk of infection. We target that lesion specifically. In the Western world, this biopsies are done through the perineum. That is the skin behind the testicle in front of the back passage. That's where the prostate lies. So patients have a transperineal biopsy. That technology is not necessarily easily available in Nigeria because I think a lot of the biopsies are still done transrectal. Transrectal biopsy increases the risk of infection because you're almost picking up the needle through a fecal organism and shooting into the prostate. So we don't do that in in other countries now. So it's all done transperitoneal. Now, when you diagnose prostate cancer, the question is going to be, what do you do about it? And without going into much details, we have options. We can offer the patient surgery, robotic-assisted radical prostatectomy. You can offer them radiotherapy, or you can offer them different types of radiotherapy, and hopefully it's localized disease. If it's advanced disease, then you offer them hormone manipulation to try and control the disease. In very bad situations, and by the time we scan them, they've got locally advanced or metastatic prostate cancer. You want to control that very quickly, and in that, we offer them a bilateral subcapsular orchidectomy. This is an operation to go inside the testicle to remove the area within the testicle that produces cancer. So by removing the area within the testicle that produces the cancer of testosterone, thereby offering the patient some element of control.
Now, I must tell you that what you've been saying is fascinating and it's wonderful, but unfortunately the program has actually come to an end. We've just got 2 minutes left and there's still so much more we want to talk about. We've spoken a lot about the prostate. We know there's also issues with the testes. There's also the huge issue, particularly as men get older, with the erectile dysfunction. But what I will for Dr. Wasiu to say a few words and then you to wrap up with your last words. But what I do promise is that in 2026, we will do a focus on men's health. We do recognize our men are important. They're very important to us. They are our fathers, they're our husbands, they're our sons. So we know that men are important. And it's not just the International Men's Day that we will be focusing on them, but a lot more. So if I can just ask Dr. Wasiu, do you have any last words for our listeners?
My last words or message is we must ensure that we manage it because our health is our power. We must protect it. We must invest in it. We must value it in order to achieve our dreams or our career in life. So good, healthy diet, adequate sleep, shun smoking, limit alcohol, and healthy diet is a key to ensure good health in men.
Thank you. Thank you very much. Dr. Leye, do you have any last words for us?
Yes, absolutely, with pleasure. Just to summarize that and concur with Dr. Wasiu, absolutely right. Health is wealth. Making sure you look after, listen to your body, seek medical advice. Do not hide away from this. Men are very stoic. They leave it to the last minute. I would encourage their wives who are listening, watch your husband. If your husband is going back and forth to the toilet or going back and forth at night, please make sure they see a referral to a urologist. We can't afford to miss this. I'm very grateful for the invitation to be involved in this call today, but very important that men listen to their body and men respond to their body. There's absolutely no shame in this. Okay, it is important you seek medical advice in the event that you have any clinical or urological issue.
Thank you, Dr. Leye. Thank you, Dr. Wasiu. We appreciate your being here. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.